Thank you. Great. Thank you so much, Tucker. And it's really fun to see all of the things that y'all are grateful for. So that's really wonderful. So keep those coming. And I want to start with introducing the behavioral health planning team. So we all work for Boulder County in the Community Services Department. My name is Marcy Campbell. I use she, her pronouns, and I'm the Behavioral Health System Project Manager on the Behavioral Health Planning team. I'm going to pass it over to Lisa.
Hi, everyone. It's great to see you again. My name is Lisa Moreno. I also use she, her pronouns, and I'm the strategic planner on the Behavioral Health Planning team. Tucker?
Hey, everybody. I'm Tucker Yerman. I use he, him pronouns, and I've been the Behavioral Health Planning team's support person.
Awesome. And then I'll kick it over to Lisa to get us started with the meeting.
So if you're anything like us, it's been so long, we're a little rusty at these meetings. So we thought that going back over our general etiquette was a good idea. So please, if you haven't done so already, put your first and your last name as your Zoom ID so that everybody knows who they're talking to or who's talking to them. Your audio in this meeting will be automatically muted. And if you are comfortable and able, please turn your video on so our speakers on our panel can see you and don't think they're talking to an empty room. Also, to engage in the discussion when it's time, or if you have questions in the middle of anything, please use the virtual meeting tool so you can raise your hand if you wish to be called on to speak, or you can also put any questions or engage in discussion in the chat. Ground rules that we just want to remind everybody of is that our goal here in all of our community meetings and all of our meetings in general is to create a space where everybody is welcome and feels comfortable. So please be considerate and respectful when you're speaking and when you're listening. Introduce yourself before you speak. Welcome and make room for all voices that have joined us today. When you're answering a question, speak slowly for the interpreters. Contribute to our meeting goals. Please try to stay on topic. Value all the different perspectives that we're hearing. We're all learning as we go here. Make sure to critique ideas and not people. Let's do our best to stay focused on solutions and always, always remember that we are striving for perfection, for progress, not perfection. And please don't engage in bias, demeaning, intimidating, harassing, or hostile conduct or commentary. Try not to intentionally speak over people or interrupt others. And do not engage in personal attacks. If one does behave in any of these ways that are not going to contribute to a welcoming environment, you may be removed from the meeting. So today, we are going to do a mindfulness moment in a second. We're going to run through a quick update of the behavioral health roadmap and where we are, what's happened, and what comes next. We'll spend a little bit of time talking about the goal of early intervention and connection to support. We'll spotlight a new program that's coming online in the community. We'll talk about the importance of language as we all engage and work in and talk about behavioral health issues. And we'll have a panel on suicide prevention and response. And then we will let you have your evening back. Oops. With that, I would like to reintroduce my colleague Tucker Yerman to you. Tucker is one of the most remarkable people I think I've ever had the opportunity to work with. He is someone who had this whole amazing, unexpected, you could never guess what it was kind of life before he came to work on the behavioral health planning team. And it had very little to do with behavioral health. And he still was a master of all trades, not just a jack, but a master of all trades, as he supported the work that we've done for the last year and a half. And I'm sad to say that Tucker has also transitioned off of our behavioral health team, and he's now supporting the work of the opioid funds, I don't know what you call opioid litigation funds, operations, and grants. So he's still in community services, still in strategic initiatives, but just working with, and still in behavioral health, but still just with the focus on the opioid funds. So they're very lucky to have him. And next time we see you, we'll have a new team member to introduce to you. And we wish Tucker all the best and are very, very, very grateful for the time that we got to work with you, Tucker. And with that, Tucker will be leading our mindfulness moment.
Wow, thank you so much, Lisa. Really touching, and just want to bring you everywhere as my hype person, because goodness, wow, you make me feel so good. Hi, everybody. Again, I'm Tucker Yerman. I'm going to lead us through just some mindfulness exercises. I actually invite you to turn off your camera, and that way you don't have to feel like anybody is looking at you. I'm going to do the thing that makes me the most nervous, and I'm going to spotlight myself. And so one of the things when Marcy asked if I would lead our mindfulness activity today, that came to my mind was, like Lisa said, I had a whole world in life and career before I came to the county, and my current job is really my first role, where I've really just worked behind a computer. And what I've noticed in myself is that there's a lot more time spent up in my head than I had before. And that's been a really interesting process. And with that has also come a lot of new challenges, a lot of new anxieties, and some new thoughts that have come up for me. And really what it has felt like is this new world that we work in, where everything is virtual and really disconnected from the person-centered side of things. And looking through a screen at other people can be really challenging. And also spending so much time on the computer or on our phones can really feel disconnected from our bodies. And I mean, I even was wondering, I'm not a teacher in any of this. I love practicing yoga, and it's been really helpful for me, and really trying to build more connection with my body as I transition into a more office role. And I'm wondering if other people can relate to that, of just, you know, this world that we're living in that is so electronic. I mean, you know, apologies for the too much information, but, you know, I feel lonely if I go to the bathroom without my cell phone to be able to scroll Instagram. And, you know, seems like every second my mind is somewhere else. And so I thought for today, I can lead us through just a couple movements that I use for myself, just to reconnect with my body. And it really, when I feel like my whole world is just up here floating around and spinning and all the to-dos, really try to bring it back down to earth. So I invite you to follow along with me. But this is really the next couple minutes for you to just kind of reconnect with yourself and your body. So if something that I show or do doesn't feel good for you, don't do it. And at the very least, spend the next 5 minutes and just breathe, and really breathe as deeply as possible. So just to start, I invite everybody to close their eyes and just start breathing. And in our breath, really start to slow it down. Keep your mouth closed if you can, and I'm gonna ask you to do something that's called Ujjayi breathing. And with your mouth closed, take a really deep breath in through your nose, as deep as you can, the deepest breath you've taken today. And as you exhale, keep your mouth closed, but constrict your throat a little bit, almost as if you're making a mild snoring noise. And that's gonna create some tension inside our core and really start to heat our core up. And so follow that as we move through some of these exercises. So with your mouth closed, deep nose breath in and nose breath out, but constricting your throat. And you should hear a little almost snoring noise, and see if you can keep that. And that will keep your body kind of sending new energy in, and really then follow your breath as we move through these movements. So to get ourselves out of our head and more into our grounded state, thought let's start by just kind of rolling our necks around, and then keep your eyes closed and just really focus on breathing deeply, rolling your head around, rolling your neck side to side, making sure you switch directions clockwise and counterclockwise. And then from here, make sure you can look over each shoulder, really see if you can look behind you, just like an owl. And then work on rolling your shoulders back. I know I tend to hunch over, especially sitting at a desk, rolling our shoulders back, peeling our shoulders away from our ears, pulling them down our spines, really starting to pull all of this energy away from our brains and into our bodies. And then from here, go ahead and put your arms up and then reach out to the side like a T. And even from here, if you can open your heart even more, really just opening yourself up, and keep breathing as deeply as you can. And go ahead and put your arms straight overhead, and put your left arm forward and your right arm back, and really twist from your stomach and from your pelvis. And your arms can go up, and your right arm forward and your left arm back. Do it one more time, but this time as you hold, see if you can twist a little bit more as you exhale. And then the last one that I'm going to ask us to do is roll your ankles and roll your wrists around. And if you're like me and you spend a lot of the day typing, feel free to rub your forearms, show them a little bit of love, both forearms. You can pull your wrist back and pull it forward. Pull your wrist back, pull it forward, really shake it around. And then in this last minute, I'm going to invite a different type of breathing. And this type of breathing for me has been really powerful. It's called alternate nostril breathing, and it's going to feel a little bit weird, but it has been shown to reduce some anxiety, and it can really be helpful to settle your mind and settle your body, and really kind of quiet things down. It actually really helps me to fall asleep sometimes at night. So you're going to use both hands, with one hand with your right hand, with your left hand. As you breathe in, you're going to cover your left nostril. You'll breathe in through your right nostril, and you'll breathe out through your left nostril. So just keep following that in breathing in with your right nostril and out with your left nostril, and alternate covering one or the other. And in this last moment, before we jump into the rest of our meeting, really want to ask you to just show yourself, your body and your brain some love. Our bodies work so hard throughout the day, even if we're just sitting at a desk, to keep our whole being moving forward. So whatever your love language is, if you're like me and you're a touchy-feely person, give yourself a big hug. If you are more of a words of affirmation person, really thank your body and thank your brain for all the work that they do for you every single day. And think of something that your body has done to really show its love back for you. If you are an active service person, really think about the service you're doing for your brain and your body in this moment, even just slowing down to breathe, twist, and move just for a moment, and the quality time that you spend right now. And this has been such a gift for me to be able to move through this with you. And I'll pass it back to Marcy so she can take us through the rest of the meeting. Thanks, everybody.
Awesome. Thank you so much, Tucker, for leading us through that activity. There were some new things that I hadn't tried yet, so I really appreciate just that you created that space for us today. And we do this in the meetings just as a way of being welcoming and just taking time to really be present together and giving us a few tools and tricks for how we can support our own well-being throughout the day. So that's just super wonderful. So I'm going to jump us forward into giving a little bit of a reminder about the behavioral health roadmap. So a little bit of the background and where we ultimately landed, some of those key next steps that are coming our way. So this is just really a brief overview of updates since our last meeting in June as well. So I recognize there may be some folks that are joining us today for the first time and lots of familiar faces as well. So I want to spend some time on context, but also focus on updates. So one big thing to know is that we now have a web page. So if you want to learn more about anything I'm sharing today, this webpage is a great one-stop place to do that. It's also a place where you can find recordings from our previous meetings. So if you want to revisit that mindful moment or share this meeting with other folks, that's a great way to find it. So just as background, the behavioral health planning team started this journey of developing a behavioral health roadmap in February of 2022. So our process from beginning to adoption was 18 months. And really we started this work of creating a roadmap because while there's so much awesome work happening in the community, there's still a lot of unmet need. And so it was really important to come together and find a way to create some local change that we could do together. Also, there were a lot of changes and opportunities following the pandemic and statewide changes that made it really timely and important to jump into this effort. So the behavioral health roadmap was developed to be a shared vision and direction to help our community get the right mental and behavioral health support at the right time and work towards a community of belonging. So if you've participated in our meetings in the past, you've heard me say that the hope is really that this could be something we all share together and that we all have a part to play in making this shared vision a reality. Not only folks that work for the county or cities or nonprofits, but our whole community together. Additionally, our team was charged with exploring the possibility of a mental and behavioral health tax for the county if the gaps identified in the roadmap supported a need for this. After public opinion polls, our county commissioners decided not to move forward with the tax in 2023. This might be explored in the future. So just to share a little about our process, we started by reviewing past assessments to understand top unmet needs and really develop focus areas for research. After we did that and made our plan for outreach, we conducted research on each focus area to understand strengths, challenges, opportunities to build upon, hopes, and ideas for solution. The data from that research phase can be found in our report on the webpage. Once we had those solutions, folks came together and prioritized solutions, and we developed a set of recommendations. These recommendations went through an input and approval process with all of our governance groups, including during our June community meeting. And the Boulder County Commissioners adopted the roadmap on August 22nd. So we did intentionally engage community members and partners in this process, folks with subject matter expertise, lived experience, and key partners, so that really it was us together building the roadmap. And so we engaged over 700 folks, and this slide represents some highlights on how many folks were engaged and how they were engaged. Some of those numbers, the community meetings, etc. Some of those things, they're not duplicated numbers, so it's just good to know. But at any rate, we just had so many wonderful folks involved in this process, including many of you, and just want to thank you for your participation. So as I mentioned, we did prioritize the solutions and then moved those into goal areas. And so I just want to mention that really our biggest takeaway from that process and all we learned from the research and from engaging folks was really just how interconnected and interdependent the continuum of mental and behavioral health is, and that we do need a full continuum to really support our community, because folks are all at different places and the place they're in today may change over time. So I have a couple of slides that really represent that interconnectedness and just how we took the high priority solutions and put them into the final 6 goal areas. So we would hear from one focus area, like treatment, for example, that one of their high priorities was prevention and vice versa. So lots of cross-thinking that happened there. So I think that's just really important to note. And again, you'll get these slides as, when we send out our follow-up information as well, just so you have all of that. So just as a reminder, the roadmap is really not a traditional strategic plan. It's really giving us a valuable starting point for us to, all be thinking together about what our shared vision is and where we're starting, but we really do need to map our path to get there and co-create that together as part of our next steps. So just want to share that reminder as well. So a quick update, some few things that have happened since our June meeting. After that meeting, we incorporated the feedback that was shared and wrote a final report, which is now available on our new webpage. We also met with the Boulder County Commissioners on July 18th for a public hearing to share the recommendations and hear input from community members as well as the commissioners. We created a frequently asked questions document that lives on the webpage and is based on the questions that we can answer really at this time. There are some questions that we will answer together in the future as we co-create implementation. So the county commissioners officially adopted the roadmap on August 22nd, and now that it has been approved, we're really getting the report translated and also bringing groups back together to start thinking of next steps. So when we met in June, we showed you kind of a draft of the behavioral health roadmap framework, and this is now the final. So this is really what incorporates all of the learnings from the process into that shared vision and direction. And it also lists our goals, strategies, and the criteria for a trusted system that was developed by our equity advisors. So just to kind of reorient, again, we do have the 6 goal areas, and on this particular framework, it lists some of those strategies, which are really coming from kind of cross-cutting themes from our solution areas. Again, this can be also found on our website, and it also goes into much more detail and lists all of the different strategies under each goal area. So it's organized that way. So it's, again, easier to find for folks. So as we move forward, as I said, there's a lot more that we have to do together. It was really an important step to get us all on the same page, really, for a shared vision and direction, and just really not only, quite the process, but also really powerful to see what folks came up with, and really inspiring. So now that the roadmap is adopted, here are some of the things that we're thinking about that could help us start moving towards implementation and doing that collaborative work together. So some of the things we're thinking about are system mapping to really get a little more detail around who's being served in our existing programs and maybe who's being missed for whatever reason, what we have out there. Also taking a look at our governance structure to figure out how do we add more voices to the table, and do we need a little different structure to help us actually plan out implementation. Thinking about use cases. So what does it look like to actually, what are some of the actual barriers that folks are running into? So all of that's really important. And also thinking about, how can we really continue to support that collaboration? So what can you be doing at this phase of the game? So a couple of things that you can be doing is, for one, think about how you can incorporate the trusted system criteria into your work, your advocacy, and in conversations. If you're working in this field, think about where you see your organization fitting with the roadmap goals, strategies, and solutions, and any places that you might want to do more or less of. And also feel free to use this as a planning document, and you're welcome to reach out to me. I'm always happy to be a person to talk through if you're planning and wanting to think about what's aligning that way as well. So if folks have any questions, you're welcome to put those in the chat or raise your hand, and I'm happy to answer anything for you. If you have any specific questions. Great. Well, most of our meeting today is going to be focused on one of our goal areas. And so, as we were thinking about, we now have these 6 goal areas. And so thinking that it might be useful to really highlight updates around those areas, have panels or discussions that might be connected. So today is around early intervention and connection to support. And so the goal statement, you can see that up here on the screen. And I will go ahead and read that for you. So our community identifies mental and behavioral health needs early, intervenes appropriately to avoid more acute symptoms, navigates community members to services, and provides low barriers to entry and access to innovative services that are welcoming to all identities. And let's see, I'm having a block here. I can't see what I'm customized to meet diverse needs and ensure cultural familiarity. So that's really that goal area, the goal statement there. And so I just wanted to name that for us. And then also just mention that there are various strategies associated with this goal area. One is community-wide navigation. Another is harm reduction. So really thinking about best practices and meeting people where they are. Finding ways to achieve easier enrollment. Suicide prevention and connecting folks quickly with best practices and supports, having drop-in supports available, and co-locating and integrating services. So that's kind of that vision and direction for this particular goal area. And so with that in mind, We're going to focus on 2 of those particular strategies today. The first of which we're going to do a spotlight on community-wide navigation. And community-wide navigation was really one of the top themes we heard about in our process. And so some of you may have been involved in past discussions. And also, I know this is a huge area of interest for a lot of folks. So we are delighted to introduce Naomi Siegel, who can share about the development of a community navigation hub. And before Naomi gets started, I just want to remind folks, if you haven't already, please do select your language at the bottom of the screen to make sure you're participating. And Naomi, we are delighted to have you. I'll let you take over.
All right, well, it's so nice to be here, and thank you so much, Marcy and Tucker and Lisa, for all the amazing work that you all are doing. So I'll give you some background to start. So the idea of a navigation hub came from a report that was done in 2019 from the Omni Group, which is a research group out of Denver. And the Omni Group asked community members and partners about known barriers when it comes to accessing behavioral health supports in our region. And the resulting report highlighted how complex and difficult it is to access behavioral health systems, and that many communities don't receive the right services to meet their needs at the right time. So this shouldn't be any surprise. I think as community members and agencies at this meeting, we all know that behavioral health can be hard to access. It's confusing. People don't even know where to start. It can be overwhelming. And so that this report just demonstrated the need for a centralized navigation hub. And this concept was, so from 2020 to 2022, Boulder County Community Services brought together key partners, programs, community members, and other stakeholders to design this centralized navigation model. And then Behavioral Health Hub received ARPA funding. So that is how this project has been funded for the next few years through ARPA dollars, which is the American Recovery Act that was passed earlier. So I'm going to just start with some background about the Navigation Hub and who this program serves. So once this program is open to the community and live, any resident in Boulder County can receive navigation services. So all ages are welcome. We support with behavioral health resources as well as referrals to resources for just general basic needs and social determinants of health. And the hub has no exclusionary criteria, which is really exciting. So again, we want to be welcoming, inclusive. Our team is going to be, the majority of our team will be bilingual and bicultural as well. So some additional information about what this looks like is, so the Navigation Hub, or it's called the Hub model, relies on a team of navigators who receive referrals from 3 main channels. So right now we have a single email address, which I'll talk about in a little bit. And we, in the future, will have a call line and also a website. And so currently we are open to all Boulder County programs only. So as I mentioned, we are not open to the entire community, only just taking referrals from county specific programs. And we provide 2 different lines of service. So immediately there was a need for case consultation, which is where Boulder County programs and staff will contact the navigation team and just need support finding a specific resource. So for example, maybe a detox center or a therapist or housing or childcare, again, whatever those needs are. And we do not actually work with the client in that situation. We work specifically with the program or staff member, because as we know, sometimes it's more beneficial to support the person who is already working with that client, since they already have a relationship established. And then the second line of service, which will be primarily how this will look once we go live to the entire community, is that direct individual navigation. So that for that service, a client would work one-on-one with a navigator. So with someone on the hub team and get connected with that specific resource that they need. And just to be clear, we do not provide the services themselves. So we don't provide financial assistance or therapy. However, we refer to those organizations already in the community that are providing those services. So the goal is not to duplicate, to provide, case management or anything like that, but we connect the community member with those resources that already exist. And then last, we use a program, a system called Unite Us, and that is where we catalog all of our providers that we use, and we can make referrals through that system to those providers if they're in the network, or we track the data that way through Unite Us platform.
One question popped up in the chat for you,
Thanks.
Naomi, is, in terms of where the team is right now, does that involve supporting Boulder Valley School District programming?
That's a really great question. So right now we are a small team. So there are only 3 of us on the navigation team. And so we are only accepting referrals from Boulder County programs right now. However, in the future, absolutely, the school district, any nonprofits, any community member, any age, regardless of language, need, can contact the hub and work one-on-one with a navigator to find that resource that they need. So it's coming. And I'll talk a little bit about what the process will look like and when we'll be going live. So that's coming up as well. Any other questions? Should look at the chat.
We got one more in the chat about how do people transition from the hub to the actual provider, and is there a warm handoff?
That's a really great question. Thank you. So yes, so the referral is made. So we would provide that client or that individual with a phone number and where they can go for the service to make sure it takes their insurance and to make sure it's the resource that is needed. And then we really encourage the client or the participant to reach out to that provider to really, feel empowered to get that service connectivity through their own means. However, we provide follow-up. So the hub team provides follow-up with the client within 7 days of the referral. And so if there is any challenge getting that connectivity, we would absolutely reach out because we have relationships with these providers. And we know often that sometimes it takes a little nudge saying, oh, I'm Naomi with Boulder County to be able to get in for services. And when I go through a few case examples later on in this presentation too, there have been absolute times where we've had to reach out to providers or nonprofits and in order to really advocate on behalf of the client. So absolutely. I think there's another question. You see.
Yeah, just checking if fire stations are also, if they are also part of county departments. So.
Yeah, so anyone in Boulder County, so any resident or nonprofit or service provider. So.
Yeah, I think the reference is in terms of right now what you're offering. So I think fire departments are usually related to a municipal or fire district, so they're not part of county government. So I don't think those are the referrals you're receiving quite yet, but coming down the road soon.
Exactly. And I'll clarify later, but since there's a lot of questions, I can just mention it right now. So the specific programs that we are working with within the county are housing and human services. So we've worked with prevention services. We've worked with community services. So CJS, which is community justice services. So the jail-based teams, BHAP, as well as DA diversion teams. So the jail-based teams. And then we've also received referrals from public health. So the WORKS program, which is a harm reduction program. So I hope that adds some clarity. I was going to get to it later, but totally fine. Any other questions? Agency. Yes, so there's a lot of great questions. So it looks like Adriana Paola. So can an agency, nonprofit, or organization get registered in the Unite Us network? Yes, absolutely. And I'm happy at the end, I have our whole team's contact information. So if you are interested in connecting with that platform to receive referrals, we can absolutely share information on how to make that happen. There's a lot of questions.
Yeah, I think this has been one of those ongoing topics that folks are really, really excited about. And so I would just encourage folks to keep putting your questions in the chat. And then if there's any questions, I know some of the things that folks are asking are coming up in your presentation, but if there's something that's not covered, we'll compile those and get those to your team so we can make sure we get answers back to folks. So
okay.
at a time. So
okay, thank you. I'll keep going and then hopefully I'll answer questions, but if not, feel free to connect after. So I just wanted to share the mission and vision of the Navigation Hub. So our mission is to provide a coordinated system of care that connects individuals with comprehensive behavioral health providers and other necessary resources within Boulder County. And our vision is to create a robust, resilient, and healthier community through coordinated access to resources to lessen the burden on providers and the community, which I know has been asked for a lot. So that's our goal. And then I also just wanted to share briefly our hub values. And so this is really integrated into our team, our culture, everything. So building and maintaining trust with clients, partners, and the community. We use a data-driven, outcome-based approach. We empower the dignity and worth of the individual. And we also have a willingness to learn and adjust. Because this is a new program, there's lots of learning and adjusting along the way. And then lastly, our team is strengths-based. We are very client-centered. So again, we focus on what the participant, what the client is asking for, not what we think they want. And then really an emphasis on prevention, harm reduction, and wellness. So again, getting those services, getting connected earlier and really focused on the needs of that individual, really catering those services. And so our current work, and I'll get into the data here in a minute, but we started providing navigation services to those Boulder County programs I mentioned earlier in April of 2023. So this was our pilot phase. So we took this actual concept that had been talked about since 2019 and put it into action by using our referral platform, which is called Unite Us, and actually doing the work and seeing how it goes. And so from May to July of 2023, the hub navigators received and successfully navigated over 110 service referrals. And so this is a breakdown of the data from that pilot period. So over 4 months, we served households, 110 clients, and these were areas that they received services. So again, I know that this idea was really focused on behavioral health and mental health. However, as you can see, the #1 requested service was housing. This may not come as a surprise to many of you on this call. So emergency housing, permanent housing, rent, mortgage assistance, the unhoused population. So we received the most referrals in that category. And then right behind that was mental health, as well as substance use, legal services, educational services, food, financial assistance, and it just goes on from there. So really, you can see that there were just a variety of needs. And so we've really incorporated this as more of a behavioral plus model, behavioral health plus, that again, catering to the needs of what the community is asking for is, yes, we're focused on behavioral health, and we understand that if folks don't have those basic needs met, it can be often challenging to focus on the mental health, behavioral health piece as well. And so I was just going to share briefly two examples of what navigation looks like, just so you can kind of get a feel for that. So we received a referral from the co-responder team, which is a Boulder County program that we also receive referrals from, I forgot to mention. And so the co-responder team goes out with a clinician as well as a police officer to respond to calls. So this was a call that a family was camping on national forest land. And so they were getting a citation. And so the hub was able to connect this family to McKinney-Vento services, which are through the school district, so through Boulder Valley School District, to get support for transportation to keep the children transported to and from school on a regular basis, because research shows that provides stability in a child's life to have the same teacher and the same friends. And then through additional navigation work, we found out that this family needed help with clothing and food and applying for child support. And the success story was that this family was ultimately referred to emergency housing program. There's a program called COC through Boulder County, and they were approved for the housing stabilization program, which is HSP for ongoing assistance. And they are currently housed and stable and receiving ongoing rental assistance while other pieces are getting in place for the family. I know there's a lot of questions coming in. Seeing if
It's okay. You can keep on
going.
going.
Okay,
Yeah.
I'll keep going. Feel free. Yeah, just let me know, Marcy, if there's anything. And then another story is our client was referred to us from the BHAP jail team. So that's a behavioral health program for clients who have exited the jail. And this client needed to find sober living program after they were released. So we were able to secure a room at a sober living in Denver for this client. And then 2 months later, the client reached out directly to help finding a psych assessment, medication prescriber, DUI classes, and a therapist. So again, establishing that relationship. Often we've noticed that, clients come back for additional resources, even if it's may not be the first resource they're asking for. And so now I'm going to talk about our soft launch, which I'm sure you guys are excited about, because we're moving towards the community. However, we can't just turn on the light switch and open this service to everyone right now, because we don't have the capacity, right? We don't have the staff just yet. However, we're going to start our hub soft launch. And so we are partnering with Marinella with Yo Connection. So Marinella Manero Goodwin, she's been at these meetings before, and she has a group called Yo Connections. And so she's facilitating community engagement and creating a pilot user cohort to receive referrals and inform us about the user experience and how we want clients to feel. So really surveying different partners. So working with agencies as well as clients. So not just agency staff, not just case managers, but clients. So we can actually get real live time feedback. So we can get feedback in real time and make adjustments to really improve the user experience and get feedback, whether it's positive or negative. And just some more information about this soft launch strategy. So we are working with Mackenzie Latendra, who is also at this meeting. So if you have questions for her as well. So she is also partnering with Nella and has a grant that is really, again, informing us to do this in the best possible approach to really reach communities most in need. So we are partnering with El Centro Amistad, Out Boulder, Longmont Children, Youth and Families, Sister Carmen, our center, Brujula Comunitaria, parents involved in education. And we're also hoping to involve LEAF, because we understand that the mountain and rural communities have been historically left out. And so we really want to get the feedback on what this service feels like for all communities, especially those who have been historically underserved. So by partnering, the goal is that we will start this soft launch, and I'll give you a timeline here in a minute, but really to slowly start rolling this out and getting feedback along the way to inform our decision making. So this is the timeline that I mentioned, and I'm sorry, this is really small. So in October, this is now. So we're in consultation with Yo Connections. Oh, thank you guys. You guys are amazing.
Got you,
You got me, Tucker. So in October, we're in consultation with Yo Connections and the hub team to create a process for engaging with a user cohort. And then in early November, we are going to accept up to 10 referrals. And so again, we're going to create this partner advisory group and adjust our strategy based on feedback from this advisory group, as well as the actual users of our service. And then as we move through December, our user cohort will continue to expand. And then if we can scoot it over a little bit, Tucker, awesome. And then early 2024 is continued engagement to inform the pilot in real time. And so we're hoping in 2024, we're going to launch to the entire county. So like I mentioned, anyone can dial a phone number, send an email, or go to our website and request to work one-on-one with a navigator and get connected. So it's coming. However, we need your help. So I'm hoping that this is interactive. So as I mentioned, the human element of what hub engagement should look and feel like is super important to us in development. So we really want to understand how we can build trust with the community and learn about opportunities to improve. And so there is a link that Tucker is awesome and going to help with. So I'll read the question, and then there's going to be a link where you can either go to this website and enter a code, or Tucker is also going to post the link in the chat. So I'll just read the question for you, and then hopefully we can watch this thought cloud appear of what you all are thinking. So in 1 to 2 words, describe how you would like to feel when you contact the navigation hub and speak to a navigator. And this is also in Spanish, so we can simultaneously get feedback in English and Spanish in one spot. So feel free to take over, Tucker.
Sure. So I dropped in the chat, there's a link to the Mentimeter. Feel free to click the link, or you can also go to menti.com and enter the code that you see on the screen, 1595044, or use your smartphone and go over the QR code on screen, and that'll also take you to the Mentimeter. And I'm going to pull our presentation down so we can start to see some thoughts coming into our word cloud. And maybe, I think there's a couple questions in the chat, and Naomi, I got one. What if a person needs a psychiatric evaluation and psychiatric medications?
Oh, that's a great question. So we have providers that do that take all insurance. So I can make some referrals right now. So often we use Mile High Psychiatry because they take all insurance, including Medicaid, and they can prescribe as well as do the evaluation, and it's all virtual, which people like. There are also in-person providers. We can make additional referrals too.
Awesome. It's great to see all these words coming together. And if you all continue to have more questions, feel free to put those in the chat. We're going to compile all of those and make sure Naomi and her team get them. And as we do after each meeting, we'll send some follow-up information, including the answers to those questions that we didn't answer today. Awesome. Love it.
This is great. Thank you so much.
Naomi, one more question. What if a person does not have insurance or much money to be able to pay for services?
So that's a really great question. So part of our job as navigators is to really connect folks with insurance if they are uninsured. So we could advise where to go to apply for Medicaid if they are undocumented or are unable to be eligible for Medicaid. There are providers that either work for free or sliding scale. There is the CICP program, which is for indigent care, where folks can still get health care there through various clinics and options. So there are a lot of opportunities. So again, our team, our expertise is here to guide and really connect individuals with that appropriate service, and really making sure they have those basic needs, such as health insurance, because health insurance, as we know, is essential. So thank you for that.
That's great. Thank you so much, Naomi. We know that navigation has been a topic that has come up over and over and over. And so it's really exciting to see kind of this pilot phase in action and moving towards a full community launch. So thank you for sharing with us today, and we hope we can have you back to kind of do the official announcement that you're ready for all the calls and different ways for community to come in. So
absolutely.
Yeah.
And just one more thing. Oh, I'm sorry. If you want to put up the last slide, it has the contact information of our entire team. I know that this is being recorded and folks can access it at a later time, but just so people can see, or maybe even in the chat, whatever works, just so you have our whole team's contact information, since there were some great questions. So we're here to help.
That's great. Thank you so much. And we'll leave that up for just a moment so folks can see. And then I'm going to go ahead and switch gears. We're about to transition to our panel on suicide prevention and response. Before we do that, we have two important resources to share to really help create a supportive and welcoming space. First, I want to mention that Rise Against Suicide has generously brought two of their therapists today to support folks who may need it individually in breakout rooms throughout the rest of our meeting today. So suicide can be a tough topic, and it's super helpful to have support if something comes up for you. If you'd like to speak with someone individually, you can send a private message to Tucker Yerman or Jenna Clinchard in the chat. By dropping down, you can see if you go to the chat, it says everyone, but if you drop down, you can select one of their names and send them a message. They may also reach out to you to check in if you have questions that we may not cover or to offer support. So secondly, during our last meeting, we got a great suggestion that really to ensure that we're creating a supportive space for dialogue that fosters empathy, connection, and belonging, that it's super helpful for us to set ourselves up well for success. And so really, we want to provide a little bit of education today on language that helps to reduce stigma and the impact of stigma. We know that language matters, and it's also language also continues to be updated. It changes over time. So I want to introduce Bill Heaston from Rise Against Suicide to provide an overview of some commonly used terms related to suicide to help reduce stigma and really support our conversation today. So welcome, Bill, and thanks so much for sharing.
Awesome. Thank you so much, Marcy, for that introduction. And Naomi, I just want to give you a quick shout out as well. Thank you so much for everything that you're doing over at the Hub, and Rise Against Suicide cannot wait to be a resource as well for you guys over there. So fantastic work over there. So my name is Bill Heaston. I'm the program director over at Rise Against Suicide. We are a Boulder County nonprofit whose mission is to eradicate any barriers to kiddos who are at risk for suicide to receive mental health services. And that's specifically to not only our common financial barriers, but also some of those social barriers as well. At Rise Against Suicide, we are particularly passionate about breaking the stigma as it really relates to mental health. Mental health is a basic need amongst all of us. And the more that we can do to ensure that we are being culturally aware and culturally caring for mental health, we're here for it. And so that's really through our free mental health services that we do provide for kids at risk for suicide, regardless of income level and regardless of their insurance status as well. And I apologize, my dog has decided that she wants to present as well.
We welcome dogs here. It's also supportive of our mental health, of course, right?
All right.
Let me know if you need me to advance a slide too.
Yes, please. Okay. All right, so suicide. As Marcy mentioned, suicide can be a very, very difficult topic to really talk about. A lot of times it makes us uncomfortable. It's something that we don't ever really want to believe can happen in our own lived experiences. But sadly, it is something that is a lived experience for a lot of us. Whether it's someone that we've known who's been struggling with suicidal ideation, or if it's even ourselves. And so as Marcy had mentioned, I just want to reiterate that we do have some of our amazing RISE therapists on this call today, in case anybody is triggered and would really like to just talk something through. We feel like it's really important and also our obligation to ensure that this is a safe space for all who are here in attendance today. And that really kind of lends itself next to why words matter. I love the fact that we're giving some space to this today. I know that sometimes our words become super ingrained in who we are. And sometimes it comes without a lot of thought or maybe intentionality. And we may even say, oh, I didn't really mean that, or that's not what I meant. But words matter because it's all about perspective to who you're speaking to and how that's being interpreted. So I really thought today, I really, really love this information out of the Canadian Psychiatric Association. It's really kind of their tell-all suggestions, not only for media, but for other bigger platforms on how we should really be talking about suicide and how we should also be addressing suicide when we're in working with people who are struggling with their mental health. So just for a couple of examples, and bear with me, I know it could be a little bit redundant or just kind of talking at you, but I think it's important to really hear and listen. And then please feel free to offer any questions or suggestions as we go through each phrase. But first and foremost, I think we really need to steer away from saying that someone has committed suicide or that they commit suicide. Instead, we really want to use the phrase that somebody has died by suicide or they've lost their life to suicide. And this is really important because the word commit really attaches shame to that death. It really attaches it as it being selfish and a personal choice, making it a sin or a crime. And using more neutral phrasing like died by suicide really kind of helps strip away a lot of that shame and really kind of puts it into a more factual perspective that yes, this person died by suicide, but they didn't do it out of a malicious intent. Mm-hmm. And I think that's important for healing, especially. Kind of the next phrase is when we say that there was a failed suicide or they've completed suicide or they've been successful in their suicide attempt. Again, we really want to use instead died by suicide or they survived a suicide attempt or they lived through a suicide attempt or there was a fatal suicide attempt versus a non-fatal suicide attempt. The notion of it being successful is brings out the shame, but then it also brings and frames a very tragic outcome as something that was positively achieved. And to be matter of fact, a suicide attempt is either fatal or it's not. And so really just kind of taking all of the personal judgment and angst as it relates to that word and putting it again more in a factual light really kind of helps frame the situation in a healthier manner. I'm going to do one more and then I'm going to see if there's any questions. But in terms of talking about suicide and mental health as a notion, you know, we know that we are in a crisis as it relates to mental health. We know that our kids are hurting. We know that our community is hurting. And a lot of times we can run away with the sensationalism of that. And we can say it's an epidemic, it's skyrocketing, like, you know, like as if there's nothing that can be done. Instead, you know, really trying to focus on what the situation is and looking at the facts again and saying, yes, suicide rates are rising. they're increasing. We don't want to spark that panic. We don't want to make suicide seem, oh, well, it's so far gone. It's such an epidemic. There's really not a whole lot that we can do any longer. But trying to take that away and taking that panic, taking the sensationalism out of it, and trying to make it again purely quantitative, and ensuring that it's based in fact and not so much in the emotion, can really sidestep all these feelings of hopelessness and feeling of a lot of us in the field that there's not much more that we can do, when there's always something that we can do moving forward. I'm going to move on to the next one. This one I think is really important because this is something that I have heard quite often, is when we call someone out as just being suicidal. So saying, hey, Bill is suicidal. That is cutting. We really need to focus on language that's less cutting and doesn't define that person by their experience with suicide. So instead, we really want to use words such as, maybe Bill is facing suicide, is thinking of suicide, is suffering through those suicidal thoughts, or has experienced suicidal thoughts. Again, defining somebody by their situation and what they're going through is not a healing operative. And so taking away and the full definition that that person is purely only suicidal is crucial in their ability to heal and to move on and to really solidify and strengthen their mental health overall. And kind of in conclusion, in terms of some of the words and why they matter, I think it's really easy for us to label. Culturally, especially here in the States, we're all about labeling. And this is an instance where labeling is not okay. So saying he's suicidal, oh, they're a schizophrenic, or she's bipolar, or they're mentally ill. Again, that sense of label does nothing to improve the situation and give hope and healing to that individual who is suffering. So instead, really wanting to look again that looking at the facts and losing language in a factual basis. He's facing suicide, thinking of suicide. They have schizophrenia. They're living with this. Or maybe they're addicted to a certain substance, or they're people with addiction. They aren't their addiction and they aren't their diagnoses. That's just a piece of what their lived experience is and their experience as a human in our society and in our community. And so really wanting to drive home this point of dignity for people who are suffering with mental health, dignity for our neighbors, and especially dignity for ourselves. Every one of us suffers in some form or the other with our mental health. And I think really trying not to label, point those fingers at others that maybe are suffering a little bit more, or there's a perceived suffering more, is really important, as we encourage one another in this space, for hope and for healing overall. And I did see that there was a question in the chat, and I believe it was from Sarah. Can you speak to the language of chronic suicidality or chronically suicidal? Yeah, so in terms, I'm going to kind of start with your final piece there, Sarah, where it says chronically suicidal. That is really where You may have a patient or a kiddo who is constantly fluctuating between this idea of passive suicidality and then active suicidality, where passive is more of the thoughts. The thought is there. I do not want to live anymore, but they don't have a plan. There's no set plan in motion that they're going to carry this out. Whereas active suicidality is really a marriage between, yes, I no longer want to live, and I have a plan. And so being chronically suicidal is really having the struggle to navigate between those different levels and risk factors of suicidality. And is that language stigmatizing? I think that you can look at that and say that it absolutely can be stigmatizing. I also worry about labels overall. Trying to look at the facts first and foremost are what is important. In our world at RISE, when we're looking at different cases, we absolutely try to differentiate between someone who is also passive as well as active in their suicidality, because it's important in how you want to approach the intervention and how you really want to support that person. And so that's really more coming from a fact base so that you can really provide the right service for the client.
Awesome. This is great, Bill. Really appreciate it. And I love the looping back to that person-centered language of really focusing on how do we reduce stigma and see the person first and not anything else.
Absolutely. Absolutely.
Awesome.
Are there any other questions? And Sarah, you're very welcome. Marcy, if we could just go to the final slide then.
Yeah. I think that is our final slide.
Oh, okay. So anyway, we did have a slide with some of my contact information on there. I'm happy to put it in the chat. If anybody else has any other further questions as it relates to that, I'm happy to do that. But I guess now we can move on over to the panel piece. And I just want to thank everyone for their time and attention this evening.
Awesome. Thank you so much, Bill. We really appreciate it. We do have a wonderful set of panelists today in recognition of Suicide Awareness and Prevention Month, which was in September. And we know, as Bill said, that suicide is an important topic that impacts our community in lots of different ways. And so this panel of experts is really here to share about our local resources, some of the human impacts, and how we can each be a part of suicide prevention and response. I want to thank Jenna Clinchard from Rise Against Suicide for her partnership in planning this panel. And 2 quick reminders before I introduce our panelists. Please, again, make sure you've selected your language preference. And don't forget, if you would like to speak individually with a therapist, please feel free to message Tucker or Jenna. So our first panelist is Katie Maffett, who is a graduate of Denver University with a master's degree in social work and is a licensed clinical social worker. Katie has worked at Mental Health Partners for 11 years in various capacities, currently as the clinical director for the Longmont region. She loves serving the community and ensuring individuals have the best access to behavioral health care with a focus on whole person care. Emma Howell is the training coordinator for Mental Health Partners. She is a recent graduate of the University of North Texas with a degree in integrative studies. Emma has been with Mental Health Partners for a little over a year, enjoying her time on the training team and making connections with the community. Bill, you got to hear Bill introduce himself as the program director for Rise Against Suicide in Boulder County. Before joining Rise in May, Bill worked on suicide prevention statewide. He graduated from Loyola University Chicago with a master's degree in social work and has done work in child advocacy and suicide prevention for many years. Next is Zach Peterson, a clinical social worker in a private practice and also as a Rise Against Suicide therapist. His approach is based on techniques such as cognitive behavioral therapy, with accepting each person's full intersectionality and meeting them where they are from a trauma-informed care perspective. Adelene Marquez currently serves as the Inspire Youth Connections Program Specialist in Boulder County Public Health, with a focus on youth suicide prevention and the promotion of mental health. She is passionate about health equity and working in partnership with youth to support their well-being and foster positive change. She facilitates a variety of trainings, such as positive youth development, question, persuade, refer, youth mental health first aid, and sources of strength. She holds a master's in public health from the Colorado School of Public Health and is bilingual in Spanish and English. She has extensive experience in engaging as a cultural broker. Last but not least, Jack Kim is the Executive Director of NAMI Boulder County, a local chapter of the National Alliance on Mental Illness, which is the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. NAMI Boulder County's mission is to provide advocacy, education, support, and public awareness so all individuals and families affected by mental illness can build better lives. So please feel free to make a reaction if you would like, and help to welcome our panelists. So I'm going to go ahead and start with Katie. Katie, if you would please share about the Zero Suicide pilot at Mental Health Partners and how this is making a difference.
Great. Thanks, Marcy. And it's great to be here, and I appreciate everyone's presentations today. So Mental Health Partners has been piloting the suicide prevention pathway in Longmont for both the adult and child and family teams since about 2021. We started doing it pre-pandemic, but the pandemic slowed us down a little bit. But really, this has helped reduce stigma around talking about thoughts of suicide or previous attempts by our individuals that we serve. The suicide prevention pathway creates a supportive environment for individuals to talk freely and without judgment, and collaboratively works towards identifying ways to minimize risk and help some stabilization. So I also want to put a shout out to Jay Winstead, who is part of our training team and also the Zero Suicide Coordinator, for really being a huge part of implementing this within our organization. But the Zero Suicide framework is really based on an organizational strategy for prevention that applies the tools of data-based continuous quality improvement to prevent suicide and suicide prevention. Preventing suicides requires the coordinated use of multiple interventions by the entire team, so not just one individual. There is no single intervention that is, effective, and no one professional or role that is uniquely responsible for supporting these individuals and preventing suicides. So as an agency, we have implemented this. We've seen, significant results as far as the individuals that have come to seek support and help. We've been able to identify the risk factors very quickly on in the process, and have implemented multiple levels of screeners and outreach to ensure that the individual feels supported. But through data collection, the hope is that we can reduce the suicide rate among our clients anywhere from 33 to 75%. That's kind of the Zero Suicide pilot goal. We also train all of our staff in various suicide intervention and prevention tools, one of which is CAMS treatment, which is collaborative assessment and management of suicidality. So all of our clinicians are trained in this evidence-based model. It is offered to clients very early on in the process, usually in that intake process, if we have identified some risk factors. It is a voluntary thing, but the folks that have participated in it have really appreciated the swift and quick connection to a CAMS therapist, the treatment model, and have really appreciated the outreach that we do on a weekly basis if we do have concerns. So all of our team has done a wonderful job, and hopefully we'll get the rest of the organization trained but that is a big feat. So
Yeah, that's huge. That's huge.
yeah,
Thank you so much, Katie. It's exciting to
sure.
hear how that's really coming together. I'm going to go ahead and kick it over to Bill. I know you did share a little bit about Rise Against Suicide, but I'm curious if you could tell us maybe just a little bit more about how Rise Against Suicide is serving the community and some of those current trends that you're really seeing in Boulder County.
Marcy, if I can just add in really quickly, just if for all of our panelists or anybody speaking, please try to speak slowly so our interpreters can keep up with all the deep language you're using.
Thank you so much, Tucker, for pausing us on that.
Yeah, thank you, Tucker, and thanks, Marcy. So at Rise Against Suicide, we serve youth 19 years of age and younger who are struggling with suicidal ideation or have some level of acuity as it relates to suicidality. And like I mentioned, our biggest way to destigmatize mental health and services is by providing free service. We have an amazing network of therapists who we connect to youth throughout the county who are specifically struggling with their suicidal thoughts. Some of the trends that we're really seeing throughout the county is a consistent referral rate from our LGBTQIA plus youth, and then also a larger referral rate coming in for our BIPOC youth, specifically our Latinx youth within the county. So kind of, through RISE, what we're really trying to do in order to meet those trends is to ensure that our network of therapists are representative of those identities that are coming through. And so not only building a network with more identities related to the LGBTQIA plus community and the BIPOC communities, but then also looking at different modalities that are more culturally sensitive and relevant to these different populations. So that's really kind of where we're seeing some of those trends and where we're really hoping to meet the need overall.
That's awesome. I know we heard time and again how valuable RISE services have been for youth as we did our research process. And if we could just tease into a little bit more with Zachary and your expertise as a therapist, how do you support individuals who struggle with suicidal ideation? And what can a person expect when seeing a therapist?
Wow. I love that question. And, just speaking from the heart, as a clinician, it's important to meet each client based on their individual needs. And also actively listening. Those two components will take you everywhere you need to go. And because of that, once you active listening, so you will actually identify if this client has plans, means, and intent. And then you will actually identify if they have support systems and what kind of strengths do they have, having that strength base. But I will say that once the stabilization piece is in place, we have to get to the root cause of whatever is happening to this individual client, right? And most of the time it's trauma. So I like to use this example. It's like, when we're born as a baby, right? So this is a clean sheet of paper, right? There's nothing on it. And we're born as a little baby, or we first coming out the womb, there's nothing on our clean sheet of paper. But as we live a little, you might experience sexual trauma, abuse. You might experience shame, within the family dynamic. You end up with these dots on your clean sheet of paper. And these dots represents trauma. And a lot of times with the clients that we work with, they don't know how to live with this trauma. And most of the time they try to find a way out, with suicide ideations or, struggling with suicide. And because we're not used to these dots on our clean sheet of paper. And so a lot of times, once we get stabilized by actively listening to the client, finding their strengths, their support system. If they have plans, means, or intent, we can dive in deep to the root cause of what's making the client have suicide ideations. And when we look at these dots on this clean sheet of paper, we can kind of dive in instead of thinking about, okay, how can we get rid of these dots? Because we can't, it's trauma. You can't get rid of it. But the ideal is, how can we live with trauma on our clean sheet of paper? It's almost like you have to recreate yourself. You have to recreate this identity with these traumatic experiences on your clean sheet of paper. So as a clinician, once the stabilization is put in place, then I believe it's important for the root cause to be understood so we can prevent suicide ideations.
That's really powerful. I think, that illustration it just really hits home, and thinking about how people want to be heard too in all of it. Super powerful. That trauma piece is really important for us to recognize how much that's impacting our community members and folks that you're seeing specifically. I'm going to shift over to Jack. So tell us a little about NAMI Boulder County and the services that support individuals and loved ones around suicide and suicidal ideation.
Thanks, Marcy. Thanks everyone for being here and for having me. What I really want to highlight, as you said in your introduction, we do education, advocacy, and support. And what I'd like to highlight tonight are our support groups. They're free, they're regularly available. We have a NAMI Connection group, which is a free peer-led support group for any adult who has experienced symptoms of a mental health condition. And we have a NAMI Family Support Group, which is also a free support group for family members, significant others, and friends of people with mental health conditions. And I think this is really where I want to point everyone to know that you can come here and find a community and a safe place to talk. You can also bring your lived experience. And at NAMI, we always say that we're experts in our own experience. And you can come together and not be judged and possibly find some new information, a new resource you haven't heard of before. You can, I'd say make a friend even. You really find a community of people who care about you. And if they haven't been through exactly the same situation you've been in, they'll be able to understand even still. And you can help others. So I encourage everyone to go to namibouldercounty.org. And if you have any questions for me, you can email us at info@namibouldercounty.org. Look into our support groups. And we have the family support group happening every week. It starts at 7 tonight. It's virtual. We also have an in-person support group that meets the first and third Thursday of every month in Longmont. And our connection support group happens every other Tuesday virtually on Zoom as well. I think these are great ways for people to connect, to feel less alone as they struggle. And definitely, if you are facing suicide, if you know someone who is, this is a really good way to connect and find others, find resources, and feel supported as you work towards recovery. And I would also add real quickly, sorry, if I didn't say, these are all for adults 18 and up. Very happy to say, though, that there is a teen and young adult national hotline through NAMI now. It's 1-800-950-NAMI. So 1-800-950-6264. That's up and running. It's also peer-led by teens and young adults. And that's up and running 10 a.m. to 10 p.m. Eastern time, Monday through Friday. So 8 to 8 our time. And that's a great new resource that I wanted to share as well.
That's great. Thank you so much for sharing the local, but that bigger opportunity to tap in too. So that's really great. Very exciting. So Adelene, I'll switch over to you because I know youth, Jack was kind of tagging on there with more youth resources. And so I'm curious from your perspective, what does the implementation of sources of strength in Boulder County look like? And how does this work support students in Boulder County?
Thank you. Yeah, so I'm going to start by defining the Sources of Strength program. And it is an evidence-based international youth mental health promotion and suicide prevention program. And it is designed to mobilize the power of peer social networks to create healthy norms and behaviors that will overall create a positive culture and environment. And ultimately, this will prevent suicide, violence, bullying, and substance use. And the mission of Sources of Strength is to prevent adverse outcomes by increasing well-being, help-seeking, resiliency, healthy coping, and belonging. And this upstream model strengthens multiple sources of support, and I'll talk a little bit more about those in a little bit. But it really wants to enhance those protective factors early on for young people so that they can rely on those when they go through hard times. And here in Boulder County, both school districts, Boulder Valley School District and St. Vrain Valley School District, implement Sources of Strength. And I am going to pause for the interpreter, but I'm going to talk about the Sources of Strength model. And it is to first train the adults, which is called an adult advisor training. So we train like staff, counselors, educators, and anyone that is really a part of the school that wants to be trained. And then we go ahead and do training for students, and that's called a peer leader training. So we really want to have a representation of different groups and that are represented throughout the school. That includes identities like interests, hobbies, sports, all kinds of students. That way we can have them share out strategic messaging campaigns and have a lot of the student body, if not all, is the hope, to engage and interact with these campaigns that are based on hope, help, and strength. And then based on all of this, we hope that this creates a positive cultural change within the schools and positive social norming that can then carry on to the community. And then going back to the Sources of Strength, 8 areas that we focus on, they are family support, positive friends, mentors, healthy activities, generosity, spirituality, physical health, and mental health.
That's great. I'm kind of hearing this thread of community as a theme too, and what is kind of that culture and community that we're creating, and from several of your responses, and just it's so helpful to think of what are those specific strengths that we can be leaning into, not only for youth but also think about those for ourselves as well. And I know that many folks want to know how they can support their loved ones, young people in their lives, and those they're in community with. And so, Emma, I would like to turn to you and ask if you could tell us a little bit about the trainings that Mental Health Partners provides and share maybe 1 or 2 top tips for supporting the folks around us.
Yeah, for sure. Thank you, Marcy. So there are quite a few trainings that we offer to the community. So as a community member, you can join. Or we could also host a private training for your organization as well. The first one that I'll talk about is the ASSIST training, which is the Applied Suicide Intervention Skills Training. That's a 2-day interactive workshop in suicide first aid. So that's a really heavy, content-heavy training that we do. But everyone that I've talked to, they really felt the training was helpful. Yeah, and that one, we have one upcoming this month, October 24th and 25th in Boulder. So if you know anyone that would like to sign up, they can reach out to me. And the next one that we have is the Intro to Mental Health and Wellness. That is about a 2-hour training. And that just provides an introductory framework for understanding mental health and signs and symptoms and how to support others and care for yourself. And that one, our next one is October 27th, and that one's virtual on Zoom. And the next one, I think we mentioned earlier, was the QPR, the question, persuade, and refer training. That one's 90 minutes. That one goes over the warning signs of suicide crisis and how to question, persuade, and refer someone to help. And then the last one that I'll talk about is the mental health first aid, which we do for adults, and then one is also geared towards youth. Those both go over identifying, understanding, and responding to signs of mental illness. And I see a question in the chat. Yes, so some of those are offered on weekends, usually the intro to mental health and wellness, but I was about to mention on the Mental Health Partners website, on our training section, we have all of the offerings of the trainings, any future dates, and then you can always reach out to the trainings email for any questions about future ones. Yes. And then for ways on how to support folks around us, as a training coordinator, I say get trained. I've been part of the QPR training, and that was only 90 minutes. And I feel much better equipped to handle some things that my friends go through. And I think also just kind of what Bill touched on, reducing the stigma, having an open conversation, creating that space for others to come to you.
That's awesome. I love it. Thank you so much for that. And then just to get a little bit more texture on some of those human impacts, I want to turn it to you, Bill, and just see if you can tell us maybe either a story or just an example of some of the impact that Rise Against Suicide Services have had. So maybe just give us a quick little impact story.
Yeah, so what I can say is I want to share some numbers real quick too, because I think that's also really important. Last year, we received 361 referrals throughout the county, and we funded nearly 4,600 sessions of therapy for youth throughout the county, which I think is really, really special and really only shows our commitment to mental health. But one story that I'm really going to share, and I've been sharing this a lot, but I was going out to a lot of different Pride Fests in June and really kind of connecting with the community. And I was out at the Lions Pride event. That one's really, really cool and special because it's youth led and youth driven. And I was at the table, and this really, really like enthusiastic youth came right up to the table, big smile across her face, and just acted like, just said, hello, hi. And I couldn't help but like respond right back with a huge smile, like, hi, how's it going? And this person, this young person felt like they acted and were interacting with me as if they knew me. And were very, very enthusiastically like just saying how much they loved Rise, because Rise had supported their mental health journey by paying for their services, their therapy services. And this young person said, thank you. Thank you so much for supporting me. I'm in a really happy place now because I was able to get access to care and services that I needed in my journey. And I think that that's what it's all about, is connecting our youth and being that sense of hope. And so that's why I'm really proud to be a part of Rise. But that's kind of those impact stories, Marcy, is it's in real time for our youth.
Totally. That's great. Thank you so much for sharing that. And just that number impact too, that's really powerful. And speaking of the theme of hope, I'm wondering, Zachary, what's giving you hope as you support individuals who experience suicidal ideation, and if there's any top advice you have for supporting ourselves or loved ones.
Yeah, I say what's giving me hope is helping clients dump some of that water out. So what I mean by that is, it's only so much a glass of water can hold until it starts overflowing. And when it starts overflowing, we can see suicide ideations, we can see people die by suicide. And so being there, having this awareness and keep promoting awareness of suicide ideations and things like that, I believe that, it gives me optimistic just to feel that people know about these struggles. And so, and if I was to give an advice, I would say, let's start promoting brave spaces, because a lot of times clients can play it safe. Having a safe space, it can be safe, but sometimes they don't feel so safe. They want to play it safe. But if you promote a brave space, an open door policy of, hey, we can always talk about anything. Because a lot of times teenagers are, different adolescents, they're more close with their friends. So if as a parent or as a guardian or whoever the case may be, having an open door household of being able to communicate and talk, no shaming, being actively listening and promoting a brave space that allow, any adolescent or whoever it is to speak their truth, that they're struggling with something or something's going on in school, or is it bullying, or, is it sexual abuse or whatever the case may be, having that bravery to speak your truth that will allow your sense of self and your sense of power to be heard and to gain your power back. Because a lot of times when we experience traumatic experience, we lose power of having a voice. So promoting a brave space, it will allow them to be able to communicate more often.
I love that. That's super, super powerful and a gift that we can give the people around us, and specifically as we're thinking about teens and young adults. So that's awesome. Thank you so much for sharing that. And kind of sticking with the teens and young adults theme, I'm going to switch to Adelene and just see, we've heard a little bit about risk factors, protective factors. I know some folks talk about shared risk and protective factors. If you can define that a little bit for us and maybe name a few shared and risk and protective factors for youth and how those might compare for LGBTQ and BIPOC youth. And if you have any top recommendations for how to support folks as well.
Yeah, so I'll start by defining shared risk and protective factors, which are key interconnected elements in life that influence the well-being and the development of individuals. So risk factors increase the likelihood of negative health outcomes, while on the other hand, protective factors enhance resilience and mitigate harm or potential harm. And I'll just give a disclaimer that talking about youth from the LGBTQI+ community and BIPOC community can be grouped as distinct groups, but they are also intersecting groups where youth might belong to both communities. So that is also something to keep in mind for intersectionality. So there may be some shared risk and protective factors, but also some unique different ones as well. So in general, some risk factors for youth include alcohol and substance use, mental health disorders, access to lethal means, poverty, violence, and then more specifically for BIPOC youth and or LGBTQ+ youth is stigma, racism, discrimination, low self-esteem, hopelessness, family conflict and family rejection, lack of culturally relevant resources, and lack of diverse and representative providers. And then for protective factors in general for youth include social support, so both family and peer support, community connectedness, and pro-social activities, including after-school activities. And more specifically for LGBTQ+ and BIPOC youth, include inclusive school environments. Anti-bullying policies is another protective factor, and a strong positive identity of their ethnic group, religious groups, gender identity. And I'll just highlight that for youth who are part of the LGBTQ community and live in a school or community that is accepting of this community, they report significantly lower rates of attempting suicide than those who do not live in a accepting community. So for my adult tips, at the individual level, encourage your youth to get 8 hours of sleep. It's like really critical in suicide prevention. And also provide that access to mental health services and counseling when it's needed. So be that connector. For family level, definitely maintain consistent communication and involvement in your youth's life. And you can really pull on that source of strength of family support. So another highlight is that LGBTQ youth who felt high social support from their family report attempting suicide at less than half the rate of those who felt low or moderate social support. And then for the community level, it doesn't matter if you have a business, if you are an employer, if you're in a school or wherever, develop inclusive and safe spaces or brave spaces for youth, regardless of their background or identity, and advocate for policies that address systemic inequalities and disparities that affect youth. And then the last one is to get trained on any of those wonderful trainings that Emma talked about to combat mental health stigma.
I love it. I love it how we're all connecting the dots there, the brave spaces piece, the trainings. That's awesome. So thank you for sharing those really tangible tips and also giving us a better sense of those risk and protective factors as well. Jack, I want to ask you if you can share a little bit about what's been helpful for those accessing NAMI Boulder County resources for those who have lost a loved one to suicide.
Yeah, I think I'm gonna start just telling you all about a book that I just picked up for the first time this week that was highly recommended to me. Got it here. It's called Healing: Our Path from Mental Illness to Mental Health. It's by Dr. Tom Insel. And like I said, I just picked it up, but there's a quote that I think would be good to share right now. He writes, "Recovery is more than a reduction in symptoms. It is the return to a full and meaningful life." Or, as a very wise psychiatrist working on Los Angeles' Skid Row told me, recovery, it's the 3 Ps. It's people, place, and purpose. He was describing the roadmap to a full and meaningful life. And the road to recovery to these 3 Ps does not run simply through clinics and hospitals. As we shall see, it requires something more than medical care. So I just realized for the first time that also talks about a roadmap. I think those 3 Ps are something that everyone can get from NAMI. And even just going to a support group, you have people there, you have a place, and being part of a community and supporting others in that community is just a good, easy way to find a purpose. And I think that the idea of returning to a meaningful life really does come into play when you've lost someone who's died by suicide. And I know that for myself, when I was a kid, I knew about suicide. And I don't think we heard about it even in a stigmatized, like with the stigma attached. It was almost like it was a fairy tale. You didn't know about it. You didn't hear about it, except maybe in a story that wasn't in your world. And as you grow up and you start to lose people who have died by suicide, and we've lost in our family, and we've lost friends, and going back to the start of this conversation, how tricky this can be to think about, to talk about. I think anytime that you find yourself facing mental health struggles with that as part of your reality, it's hard. It just makes it so complex to navigate. So helping to be there, you know, my wife, Anna, she's a support group facilitator. She's lost people to suicide, but she also has not lost everyone. And so I think the word I want to, you know, if I answer this with one word, I'd say hope. We help people leave our groups and our classes and our programs with a little more hope, in addition to understanding, knowing that there's lots of ways things can turn out and that we can really work to support each other. I think that's something we can really share. And I hope that I've answered the question correctly.
You absolutely have. And I think that's a powerful way to leave us, with really reflecting on that hope that we can prevent suicide in our community. And we have lots of great resources in our community to really support folks, and including peers, right? As you're saying, Jack, that we all can be helping in community with each other. And so I just want to thank each of you. And I want to invite Jenna Clincher to say any closing comments that she may have.
Thank you, Marcy. Thank you, Behavioral Roadmap team, for having us tonight and inviting us into this really critical conversation and important community conversation. And thank you to everyone on the panel for, you know, sharing experience, strength, and hope around suicide. And I think I just want to say, like, sorry, I have a feral cat that's adopted us as his family, and he literally just walked up as soon as I turned this on. So he'll be joining us. But I just want to say, like, what I heard on this panel tonight and what I take away from this is hope and also connection. Like, what I heard everybody share was connection, right? Connect with someone. And if we can all just take a moment to pick up the phone, send a text, send an email, right? Check in on someone. But we're not alone in this community. We have resources, we have help. There's places that we can go. And to parents who are struggling with their kids, call Rise Against Suicide, right? For people who need groups and help, go to NAMI. Boulder County has so many resources, but I think it's just important to remember that we're not alone in this journey. There were almost 40 some people on this call. So that means there's 40 some people in the community that care about behavioral and mental health in our community. And the mental health partners can help you find those people. Rise Against Suicide, NAMI, just reach out and let's keep the conversation going. Let's break the stigma around suicide, and we can do that together as well. Thank you, everyone, for being here tonight. And thank you again for having us.
Yeah, thank you so much, Jenna. We really appreciate it. And we did put some resources from Rise Against Suicide and other places in the chat, as well as a list of some of the upcoming trainings that Emma referenced as well. So we just want to make sure that you're connecting and linking into all of those. And as we're just closing out our meeting for today, just want to mention that we will continue to have these spaces for us to come together and talk about important topics like this in community, and share resources and learn how we can be supportive of each other. One tangible way you can share your thoughts is to weigh in on naming Boulder County's mobile crisis response. So there's an opportunity to do that, and we will also send that out in our follow-up resources. But if you want to grab that in the chat and suggest a name, that would be super great. They really have been thoughtful about trying to find a name that works in both English and Spanish. And again, we anticipate that we'll have a winter community meeting, but we have not yet picked that date. So go ahead and stay tuned. We might have other ways to weigh into the process as well. We're really in these forming of next steps and welcome your input as well. So thank you so much. We're very grateful that you've joined us today for the Behavioral Health Roadmap Community Meeting. And stay tuned for a follow-up email with materials from today's meeting, a link to a survey to give us feedback, and also don't hesitate to reach out and check out our website where we'll have these things as well. So thank you again for being with us. Have a great night.